talked about was the 2 new indications for the treatment of excess submental fat. Within the last 2 years, we've had the FDA approval of both Kybella and also the Cool Mini, which is the applicator for the Cool Sculpting device that fits here. And so my goal was kind of to discuss the pros and cons of each, which patients you would choose for each, and how we use it in our practice, either together or separately, and how we choose for which patients. Certainly, you don't need to have the Cool Sculpting device because it's an expensive piece of equipment, and you can do the neck with Kybella, but there are limitations. On label, you're supposed to stay in the middle of the neck right here because there's a nerve called the marginal mandibular branch, which could be, the nerve itself won't be damaged, but the fat layer around it will be, and that will affect the conduction, and it can create a smile that is not symmetric, so you absolutely want to avoid that. The way to be absolutely sure to avoid it is to stay in the middle, but potentially you could get a nerve identification device called a stim pod and actually trace out the nerve, which can be very variable in different people in their anatomy. So if you stay a centimeter on either side away and use very small amounts, you may be able to treat the lateral neck. But if you stay on label, we found that we like the Cool Sculpting, so we treat this side and then we treat this side. They overlap in the middle where you have the most fat. You can't do it both at once, so it takes 2 treatments on the same day. And that is for like relatively larger necks. So if there's a large neck, there's a lot of fat, it takes a lot of Kybella, we find we debulk it then with the Cool Sculpting, and then when it gets down to being more mild to moderate, we then use the deoxycholator Kybella, and that's kind of how we've been doing it in our practice.